In today's video, we're going to talk about hip pain, different types of hip pain, how to tell which type you have, and how structural integration addresses hip pain and how it can resolve hip pain. So, as we've been talking about before, most of the pain issues that we've talked about, from back to neck to shoulder to ankle, have all had to do with structural and muscular imbalances between the agonist and antagonist muscles, the front and the back, the inside and the outside, or permutations of those. The hip is no different. It's no different. People have hip pain in their buttock, they have hip pain in the joint itself, they have hip pain in the front, they have sacroiliac pain, and they'll have often pain in the groin. Any of those can be resolved with structural integration. So, the first is to determine which type of pain you have. Now, in the first session of structural integration, I'll be working in your hip area. Okay, this is the classic first session of structural integration. I'll be working in the hip area. I'll be working on your gluteal muscles. I'll probably touch into some of your deep rotators. I'll touch into your iliotibial band here. I'll touch into a little bit of the front of the pelvis here, perhaps. If you come into me and you tell me specifically you're here for hip pain, I'll probably work wherever I need to work to resolve that pain temporarily during the first session. Now, what's key to understand is about any of these is that there is temporary relief and there is long-term relief. The reason why you do a 10-session series is to get the long-term relief by changing the entire structure of your body, the entire balance of the musculature and its and your neurological patterning, the way that your brain tells your muscles to tension, and you're also learning habits. There are other things that I give you during this. It's really a three-step process. But for the body work itself, it's about balancing the tension in the soft tissue between muscle groups. And in the hip, it's no different than the shoulder or the ankle or the neck. The first session of structural integration will address this. Usually, you will get some relief, and you will know then whether or not it makes sense to do the rest of the series or not. If you don't get relief, why then it may not be a good idea to do the rest. If you do, it'll probably make sense, and it'll be a no-brainer.